Discussing echocardiology is Heart Center Supervisor of the Ultrasound Department and Technical Director of Echo, Gloria Ortiz. Ms. Ortiz, please tell us exactly what an echo is.
An echo is ultrasound of your heart. We look at the anatomy of your heart, chamber sizes, wall motion, wall thickness, structure of the valves, and blood flow. It's a non-invasive test, which means no needles, no dyes, and no radiation.
How long does an echo take?
Ultrasound echo takes about approximately 30 minutes. It depends on how easy it is to get the pictures and how much pathology we find.
I understand that my family cannot come with me when I have my echo. Why is that?
Family members are asked to wait in the waiting room because they become a distraction to the technologist who's doing the test, and we want to make sure that we get the best test and we can concentrate fully on the exam.
What is the difference between an echo and an EKG?
An EKG is the electrical impulses of your heart in the short period of the EKG that is taken, where an echocardiogram is a complete look at the whole anatomy of your heart and how everything's functioning and moving. We're actually looking right into your heart with ultrasound.
What is the difference between an echo and a stress test?
A stress test and an echocardiogram are two completely different tests. The stress test will look at your heart under a stressful situation, such as exercising on the treadmill. It will indicate blockages through your EKG and your nuclear stress pictures. An echocardiogram shows the anatomy of your heart, the structure of the valves, and blood flow.
Can I eat breakfast before my echo?
An echocardiogram, there's no preparation. You can have your breakfast and you can take your medication unless you have a stress test following, in which case you have to follow the directions given to you by scheduling for that test. Most of the time you will have to fast.
Does this test show blockages or stents?
We don't see blockages or the stents that may have been placed on an echocardiogram.
Do I have to get undressed for an echo?
With an echocardiogram, we do have to get to your chest area, so you will be asked to undress from the waist up. Women will be given a gown to wear, and it will be more convenient if you wear a pullover, sweater, or shirt.
Why do I have to lie on my left side during the echo?
With an echocardiogram, we have you lie on your left side. The reason for that is ultrasound does not go through air or bone. So lying on your left side moves the lungs out of the way so we can image the heart better, and the arm up under your head opens the rib spaces because we have to get between the rib spaces to get a picture.
What if lying on my left side is uncomfortable for me?
If you can't manage to lie on your left side, the technologist will work with you to make you comfortable and to get the proper ultimate pictures.
Why does the transducer have to be pressed into my skin?
We use a small camera called the transducer to get the images. We have to apply pressure in order to get those pictures, especially between the rib spaces. If the pressure becomes too intense for you, please let the technologist know.
What does the echo test show?
The technologist cannot give you any information about the test. The study will be read by the physician, and your ordering physician will give you the results.